Never do this when measuring blood pressure. In this video, I'll cover 12 common mistakes almost everyone makes. These errors in blood pressure measurement can have serious consequences by altering or falsifying results. For example, your pressure is 120/80ths, 12 by 8. But making these mistakes could show results like 160 or 150. They can greatly skew results, both higher and lower. Some errors I'll explain can falsely lower blood pressure readings. Your pressure may be high, but these mistakes make it appear lower. What are the consequences? You might miss out on necessary treatment. You could have a heart attack or stroke because of this, or you might take unnecessary meds with side effects, risking fainting. So you can't make a mistake on any of these points. There are 12. I'll give you a tip about a common mistake that impacts your treatment. Write down all these points for clarity and correct measurement. What are the mistakes? There are 12. I'll start with number 1. After each mistake, I'll explain its consequence. How many points will it skew the result? Up or down? Agreed. For example, if the error increases by 15 points, 120 could read as 135. These are the points I'm covering in the video. It's important to understand this to follow the whole video. Error 1, not resting 5 minutes before measuring blood pressure. Sometimes you might have been exercising or walking to the clinic where you get your blood pressure checked, or you were climbing stairs. When I worked at a health center, many people biked in for blood pressure checks, which can falsely raise it by up to 12 points. That's quite significant. Often, this difference could determine whether treatment is needed or not. So, rest for at least 5 minutes sitting down without checking your phone, as some videos might raise your blood pressure, okay? This is really interesting. So sit quietly for 5 minutes, then take your blood pressure reading. The second common mistake is talking during the blood pressure measurement. When I told patients this, many asked, "But what does that have to do with it? Why can't I speak?" Some think it's nonsense, right? But if you think about it, talking can actually alter the relaxation of your blood vessels. If you speak during the measurement, it can increase your reading by up to 7 points. Interesting, isn't it? This applies at home too. Sometimes you're taking a measurement, someone talks to you, and you end up with an inaccurate result. The third mistake, also very common, is the difference between arms. You've probably noticed that results often differ. Which one should you consider? Left arm or right arm? Some say right arm, others say left arm. What do you think? The answer is, arm side doesn't matter. You should consider the higher result. That's what represents your blood pressure. So if one arm reads 125 and the other 120, you go with 125. I often see videos online claiming the right arm result is the true one. That's such bad health advice. The correct result is the higher one. If the difference between arms is over 10 points, consult a doctor. It could be a vascular issue like narrowed blood vessels, which can be very serious, okay? It's not normal to have differences greater than 10. It's either a measurement error, device issue, or a blood vessel problem. This increase could have serious health consequences. Treatment and investigation are necessary. Got it? A difference greater than 10 is a warning sign. Mistake number 4 is about leg position. Crossing your legs can increase the result by up to 15 points. That's quite significant. So don't cross your legs. Where should your feet be? They should be on the ground. Often you're on a medical stretcher for a pressure check. I've seen this many times. Feet off the ground can falsely elevate pressure. It's a big mistake, okay? Sit in a chair with feet on the floor. Mistake 5 is about arm support. An unsupported arm below heart level can raise pressure by 7 points. So you need arm support. You know those dining chairs with armrests? Support your arm at heart level, all right? This ensures an accurate reading. It's another major error. If you raise your arm above heart level, it can falsely lower your blood pressure, okay? So be careful about positioning. The 6th error, still about posture, is that you need back support. Sitting on an exam table without back support can falsely raise your pressure by up to 11 points. These are common mistakes. Have you made any of these 6 errors? Probably yes. See how many errors can directly impact your treatment. So, sit with back and arm support. Another common error, number 7, is about cuff size. You know the armband they put on your arm for measurement? You need to know your arm circumference and if the cuff is suitable. How do you know this? If you look at the cuff, there's a number on it. If you have a device, you can check. Usually they set this number between 34 and 42, sometimes up to 44. For weightlifters with large arms using small or normal cuffs, results can be falsely high. This can raise readings by over 10 points, sometimes more, depending on arm size. Why did I say this is common? As an endocrinologist, I see young patients for secondary hypertension, but often it's just a measurement issue. They have normal pressure, but use devices from relatives with smaller arms. Bodybuilders need larger cuffs, or results will be inaccurate. Similarly, using a large cuff on a thin arm will give falsely low readings, lower than they actually are. Did you know that? So, know your arm circumference and ensure the cuff size is appropriate. This info is easy to find. Check the cuff, you'll see the size. Make sure it fits. If not, get a compatible cuff. It directly affects the reading. Often with the right cuff, young patients' pressure is normal. Some were even on meds unnecessarily. See, I told you this video was important. Athletes with no risk factors sometimes take unnecessary blood pressure meds just because of the armband issue. Mistake number 8 is about caffeine. Avoid caffeine for at least 30 minutes before measuring blood pressure, as it can falsely raise it by 10 points or more. Take note. So, avoid caffeinated drinks. When I say caffeinated drinks, that includes green tea. Did you know green tea has caffeine too? Coffee, sodas. Avoid any drink with caffeine. Some might say, I'm used to caffeine. I drink coffee all day. Will it affect my pressure? Often, your body adapts. So it depends on individual sensitivity, okay? Not everyone's pressure rises with caffeine, so know your own sensitivity to it. I always remember a patient taking 3 blood pressure meds. During our chat, I noticed he drank coffee all day. I suggested switching to decaf, and guess what? His pressure improved. He was sensitive to caffeine. Drinking it all day was constantly raising his blood pressure. That simple change was the solution. So here's a tip. If you have high blood pressure, try switching to decaf. It might help. Remember, everyone's different. Some people won't see any change. What happens when you drink coffee? It doesn't affect me, I've tested it. But for many, coffee can raise blood pressure. Share what happens to you in the comments. And number 9, measure your blood pressure with a full bladder. You need to use the bathroom before taking your blood pressure. This can raise your pressure by up to 15 points. Look, it's more than many other errors, so don't take the test with a full bladder, okay? It can activate what we call the sympathetic nervous system. Now, that's interesting. This can falsely elevate your blood pressure. Error 10, I'll highlight 2 situations. First, white coat hypertension. What's that? Patients who only have high BP at the doctor's office, for example, this can increase systolic pressure by up to 30 points. Look, that's really significant. There's also masked hypertension. High BP outside the office, normal at the doctor's. If anything happens, the doctor's right here. This relaxes blood vessels, giving a false normal pressure when actually hypertensive. So you need to take measurements at home and monitor regularly. I'll add error number 11, not doing this monitoring. How will you do it? How will you measure blood pressure at home? How often? If diagnosing or treating, a week before your appointment, take 3 daily readings. Note times, values, and heart rate. This gives the doctor 21 measurements to average, helping them visualize and treat more effectively. Remember, 20 to 30% may have white coat or masked hypertension affecting treatment. What happens if you don't need treatment? Your blood pressure is normal, but high at the doctor's office. The doctor might prescribe unnecessary medication, causing fainting at home due to hypertension. Conversely, not getting needed treatment can have consequences, so it's necessary to monitor blood pressure at home. Take 21 readings, 3 daily for a week, average them for an accurate diagnosis and treatment. Mistake number 12 is about blood pressure devices. I strongly recommend using only arm-based digital monitors. The wrist monitor can give false results more often, with a higher error rate. Got it? I know some devices are validated, but the arm cuff monitor is more reliable and has fewer errors. The 12th error is about the devices themselves. Did you know many devices don't actually work? That they failed quality tests? Even some arm monitors are sold without proper certification. Since this video isn't sponsored, I'm not paid by pharma or any company, so I'll share a website. It's this address here. It lists various brands and types of devices that have been tested and validated. You can choose which one you think is best from these options. Now, what's the big mistake almost everyone makes? It's not calibrating the blood pressure monitor at least once a year. Did you know the device needs calibration? Could it be giving false results? Many people use the same device for 8, 10 years. I see this often, but no one ever mentions device calibration. Did you know? Comment below if you didn't know this. This could be directly affecting your health. So how do you calibrate your device? If you have the box or manual, you'll find a contact number there. The supplier will provide options. Authorized service centers or manufacturer locations for calibration. No box or manual? Look up customer service online and follow up, okay? Especially if it's been years or never calibrated, as it can affect your treatment. What are normal blood pressure values? I know you'll ask. So I've prepared a table with 2 references. The first reference is from the American Society in the US. The second reference is from Europe. You'll notice there are some differences. I won't go into details, but I've left the values for you to check and see these differences between societies. On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more videos like this. Were you making any of these mistakes? Write here which city you're from. I always like to know. Which part of the world are you from? I'm from Porto Alegre. Now I'll suggest a video for you to watch. It's a video where I talked about vitamin B. Did you know many signs and symptoms can indicate vitamin B12 deficiency? If untreated, this deficiency can even lead to dementia. So it's very serious. Click here to watch that video. I'm sure you'll enjoy it. Take care. See you next time.